today. Today we have a conversation, one that I have often with students. So I thought I would invite a student and an expert in this field to join us in a conversation around careers in the medical field. So we have with us today Eunice Leba and TJ Moore from De Montfort University, who is a professor there, and I will let you both introduce yourselves now individually, and we can get to know you and then start the conversation. Eunice, do you want to tell us where you go to school and what grade you're in and what your interests are?
I go to school at Nelspruit High School in the Lowveld, South Africa, and I am 11, and I have an interest in the medical field.
Great stuff. Thank you, Heidi, for inviting me here today, and I'm looking forward to having this conversation. My name's TJ Moore. I'm a senior lecturer in biomedical sciences and medical sciences here at De Montfort University in Leicester in the UK. I'm also the program leader for the biomedical sciences course here at De Montfort. So I started off as a biomedical scientist, and I basically worked my way through my career, and I've been exposed to a whole lot of different things. I think one thing that students often find difficult is they're not exposed to a lot of career options. We get told to become a lawyer, a doctor, or an engineer. And those are the three things you go to university for. And I even know in my own experience, when I was your age, Eunice, and at school, we didn't have a very good guidance counselor. I think they took us once to a big city, to a university expo, and what we did is we walked around and collected pamphlets. Still had no idea. That was kind of our introduction to what university can offer and what careers were on offer. So I think it's always a really difficult thing to make a decision into which field you want to go into, which university you want to go to, what course you want to study. It's a big decision to make when you've in reality had very little experience of the real world and what those real careers are. You say to me you're interested in the medical field. Why? I mean, a lot of the time it's because you've grown up watching Grey's Anatomy, or in my day it was something called Saint Elsewhere. Do you remember Saint Elsewhere,
yes,
Heidi?
Of course, yeah.
There we go. So let's start with that, Eunice. Why the medical field? What makes you interested in the medical field?
I have been asking myself this question a lot lately, but I went to shadow a lot of doctors this past couple of years, and both my parents are in a medical field. They're not doctors, but they're in that kind of field, and I absolutely love the research behind this, and I don't know how to explain this, but like it's the mystery behind the whole. Sorry, my words on.
That's fine.
But I just love the way the doctors work with the patients and all of that. So that was my main reason for wanting to go into the medical field.
Okay, so one of the questions when I do careers fairs, or we have open days for students to come and talk to us to find out about our degrees at our university, or the different universities I've worked at, one of the things is a lot of students go, I want to be a doctor. And one of the questions I'll always say to them is, what kind of doctor do you want to be? Do you want to be a doctor that finds a cure for cancer? Or do you want to be the type of doctor that treats patients for cancer? What do you think, Eunice?
I read a book and they also explained this to me, like the difference between curing cancer and treating cancer. And I like working with the patients. I liked when the patient comes in and the doctor meets the patient and then they go into the surgery. I love that part. But I'm very split at this moment because I absolutely love research. I love looking through the microscopes at school. I love that as well. So I don't really know much about, I only know the medical field as a doctor's point of view. I don't know the research part. So I've never shadowed someone or asked someone about the research part, but I'm very open-minded at this moment because I love that as well.
Listen, there's no reason why you can't do both. It just means that you're going to be studying for a very long time, because usually what happens is somebody does a medical degree which depending on which country you're in can take up to 6 to 8 years to do a basic medical degree, and then you still need to specialize. And then if you go the research route, you end up doing a PhD, which is another 3, 4, 5 years, especially if you're doing it part-time. So you could be in your mid-30s, some people even in their 40s by the time they've got all of that together. You don't always have to have the qualifications to do the research. You can still be, if you did a medical degree and you wanted to be involved in research, there's routes to be involved without actually being a qualified scientist in that sense. So it's interesting what you say, because there's a lot in that. One of the first things I take from what you're saying is you like the people interaction. You like involving yourself with people. That is a big part of being a doctor, a medical doctor. And you've also got to remember though, is it a GP? Is it a specialist working in a hospital? Again, you've most probably had a lot of exposure to your GP. It's personal experience. You've gone to a GP since you were a child. That's a very different type of medicine than working in a hospital. Being a specialist in a hospital also depends on which country in the world you work in. Some countries, being a GP is you kind of sit behind a desk all day writing prescriptions. That's all you end up really doing. Where in some countries, being a GP is you do little bits of surgery in your GP's office, you do diagnoses. Depends where you are, where you're practicing. So be realistic in your mind as to how that works. The other thing I would say is, yeah, so you said you like the people interaction. There's lots of careers in the medical field that you can actually have that kind of people interaction without having to be a doctor. An example of that is obviously nursing. That would be one of the first ones that would come to mind. And again, nursing, I don't think gets enough good press. People think that it's all dog's body work, that the doctors tell you what to do and that's it. You can specialize as a nurse. You can specialize in different areas. You could become a midwife, right? Nursing and midwifery go together. So if you love the idea of helping ladies go through their pregnancy and bringing babies into the world, it's an amazing experience that you could become a specialized midwife. For example, another area is at our university, we offer something called a physician's assistant or a physician's associate. Now, this is quite popular in America at the moment, and it's been taking off here in the UK as well. And what a physician's associate or a physician's assistant is, depending which country you're in, is you're kind of halfway between a nurse and a junior doctor. So there's certain things you can write prescriptions for, you can make a diagnosis on certain things. So essentially you are a junior doctor. You're helping the doctor, but you're more senior than a nurse, not quite a qualified doctor. And that's a master's degree that you do. So you do an undergrad degree in, for example, something called biomedical science or medical science. And that then gives you entry into a physician's associate course. And then those courses are very practical oriented. You're almost out on placement in a hospital from day one. So it's very hands-on, and then you'll come back to the university a couple of times, maybe a month or a year, depending on the university that you're at. You'll do some intense theory. You'll have exams, and then you go back into placement. So the placement is a really big part of that. And at the moment in the UK, that's very popular because the government's pushing that, there's support for that. And in America as well, it's also very popular. The thing is, you need to decide where you're going to study, where you want to practice because of rules and regulations. You're obviously, when you're taught, you're going to be taught specifics about how to work within individual countries. So if you end up studying in the UK, but you want to work in the US, for example, you're going to have to end up taking a different type of board qualification exam at the end. Whereas if you're doing it all in the same country, it's one leads into the other, and it makes life a lot easier.
It's a very interesting, I've really never thought about a physician's assistant, but you know, a physician's assistant, it's like kind of a triage nurse in a way is what and it's not something that really exists in South Africa.
No.
And I think that it's actually something that's hugely needed here. Especially, given the population, given the amount of qualified doctors who are leaving South Africa. I think that, it's hugely needed, whether, the government will recognize it or, is a different story. But it's a really interesting pathway because, I mean, I think Eunice, for your, you're wanting to interact with people. I mean, it seems like a physician's assistant is probably, that kind of, you have some medical knowledge enough to be able to point somebody in the right direction or connect them with the right type of doctor, or, and also have that, the care that, a nurse, would provide. You can provide that as well, but also be able to direct a patient where to go. So that's really interesting. Yeah, I never really thought about it. So thank you.
Yeah, so that's a direct link with medicine. It's almost, you're not quite a doctor, but you're doing a lot of the stuff that doctors do in a case. You're still going to work with a patient. You're still going to, I'm trying to think of the right word at the moment. I want to say inspect the patient, but that's not the right word. But you're going to be able to evaluate their signs and symptoms. You can do some tests on them. And depending on what country you're in, you can even, like I said, you can do prescriptions. There's certain things physicians, assistants, and associates are allowed to prescribe. So, and you usually end up finding, I think I saw something recently trending on one of the social medias about the amount of interaction between the physician's assistant, associate, and the patients. They actually end up building up quite a bond because you're at the front all the time. You're doing a lot of the personal work with the patient before the doctors actually end up coming in and make the final decisions. Doctors end up tending to flitter quite a lot. They're all over the place. So depending on how busy you want to be, how much of a connection you want to make with patients. I mentioned a little bit earlier, medical science. Medical science is at De Montfort, we offer that, and it's at different universities as well. And that is also, it's more patient facing. So you would work with patients, taking blood pressures, doing diagnoses with them. A lot of the time, people in medical science, for example, you can go into different fields. You don't have to stay just treating patients. It links with biomedical science because you can become an editor, you can become a researcher. There's lots of things you can do with a biomedical science or a medical science degree. And if you're not sure what to do, I actually think it's a great degree to do because it gives you a fantastic foundation. A lot of students actually take biomedical science or medical science as, if they can't get into medicine straight away or they haven't made up their mind, they start doing one of those degrees and they either complete it and then they do a graduate entry medicine program. So they have the one degree and that gives them easier access into graduate entry medicine. Or some countries, some universities, if you do 1 year in that degree and you apply to medicine the following year, let's say you were unsuccessful the first year, getting in, if you've got the degree under your belt, it kind of elevates you to all of the other people just coming out of school. So there's maybe an improved chance for you to get into medicine.
What does biomedicine consist of? I don't know.
Yeah, that's fine. So biomedicine is, again, I trained as a biomedical scientist, so I'm biased, all right? I think it's a fantastic course because if you're interested in biology and medicine and you're not 100% sure which direction you want to go in, it gives you a fantastic foundation in biomedical sciences. You don't have to become a biomedical scientist if you do a biomedical degree. So traditionally, a biomedical scientist is somebody that works in the lab. So you go to the doctor, they take some blood, they send it to the lab. The person that tests your blood or the samples that they take from you, let's say they took a skin scraping or something, that all goes to the lab. The people in the lab are the biomedical scientists. So they actually analyze all of those samples. They will then give a report to the doctor saying, this person's sick or this person's normal, there's nothing wrong with them. All of their blood results are fine. We can't find anything. Or they'll say, we see an elevation in cancer markers, or their red blood cell count is too low. Or if they've done a skin scraping, they might say it's a bacterial infection or it's a fungal infection. So they're the ones that are actually helping the doctor make the diagnosis. It's not patient-facing though, usually. It's very rare that a biomedical scientist actually comes in direct contact with the patient, unless they're taking a blood sample, which isn't always within their remit either. That would be a phlebotomist's job, or the nurse or somebody else. So yeah, it's traditionally, that's what a biomedical scientist does. But again, that biomedical science degree allows you to become a biomedical scientist. It allows you to go on and become a research scientist in one of those biomedical kind of areas. So you could go work at a pharmaceutical company helping them test things on cells. You could go and do a master's or a PhD to become a research scientist in a specific area. So during your biomedical science degree, you might find out that you love finding out about viruses, because that's one of the things you'll cover. In microbiology, there's an area called virology, and in COVID now, that's very topical. So it's...
Yeah, I was going to say, that's, yeah, biomedical scientists, I mean, at this moment in time, you know, it's very relevant. You know, there's also a lot of biotechnology labs, you know, where I assume, you know, as a biomedical scientist, you could also work in a biotechnology lab where they're developing new and innovative ways to treat viruses or bacteria. And as well, there's a huge growing area in public health and global health, especially given this pandemic and what affects health, you know, nutrition and, you know, various environmental factors. So a biomedical science degree, I would assume, you could also go on to do a master's of public health or global health or medical anthropology, or those areas as well.
That's why I'm saying I think it's a fantastic degree, because it's quite broad. So I'll give you an idea of some of the subjects you do in biomedical sciences, and you'll see why I say this, because you get a foundation in so many different areas of biomedical science that you can take those and go do, just like Heidi said, in different areas of biomedical science. It doesn't have to be a master's in biomedical science. It could be public health. It could be advanced biomedical sciences. It could be in anthropology, because you've got a good foundation. You do anatomy and physiology, you do microbiology, you do biochemistry, you do chemical pathology. So you learn about the normal parts of the body, how the body would normally function. And then you also learn about the diseases, the disease processes, cancer, for example. So you'll learn how normal cells function, how cancer starts, how we treat cancer. You get all of these kind of foundation ideas and ideologies about these topics in that subject, and then you can decide which one you like. So it's almost a bit of a smorgasbord of biomedical topics that you learn about in biomedical science. If you're not sure which one really interests you, you might find out you really like microbiology or you really like cell biology. You can then go on to specialize in that. When it comes to the career options, like I said, you don't just have to become a biomedical scientist. You can go work at biotechnology firms, pharmaceutical firms. You can work for a medical writing company. So pamphlets that you get at the GP's office, somebody has to write those. You've got all of this medical knowledge now, this biomedical knowledge. You can put that into practice in writing those little pamphlets, or writing for textbooks, or helping people write journal articles. You can also think when you take when you buy a box of medication, and there's that in all the instructions, somebody has to write that. You need a medical knowledge on how to write all of that. So that's one of them. Some people become sales reps. You need for pharmaceutical companies or for medical device companies. Again, all of that anatomy, all of that biochemical, biological background that you've learned helps you improve in that job.
You know, one other thing that I'm going to bring up, and this is just from personal experience, and TJ, it would be interesting to get your input, is that having had a family member who had a mystery illness, went from, you know, gastro to GP to GP, 16, 17 doctors, nobody could figure it out. We ended up at a functional medicine practice. And this was very interesting. So there was one actual MD there, but the person who actually put 2 and 2 together was not a doctor. They have registered nurses working there. They have biomedical scientists working there. There was another discipline, a pharmacologist, a natural pharmacist. So she specializes in pharmacology using supplements and you know, non-prescription medication, because oftentimes people with these mystery illnesses have had an overexposure to medications that their body has reacted to. So that's another area, you know, like functional medicine is a hugely growing area at the moment, because you're looking at the whole body and the whole system. And medicine is just one part of it, you know, the actual medical doctor.
Yeah.
So I don't know what your input is about that, and I don't know how popular that is in the UK. I know in America it's a hugely growing area.
Yeah, I actually work with a private clinic here. They work with Alzheimer's and dementia patients. So I'm a scientific advisor for them, and they take a functional medicine approach.
Oh, wow.
The clinic director is actually started off as a biomedical scientist. So, and they work with a herbalist, and they work with a dietitian, a nutritionist. So all of that together, they help them treat people. So coming from a biomedical background, moving into functional medicine, I'm not personally aware of any qualifications in the UK, like university qualifications that are functional medicine based. But if you did a medical science or a biomedical science degree, that gives you a good foundation. And then you can top that up with online courses or international courses. I know that there's practitioners here that do that. They've taken their initial university qualification, and then they've topped it up with functional medicine courses from overseas, which they get certifications for. And I totally agree with you. It's conventional medicine doesn't always get it right. It's sometimes, and I have my personal opinions on that. I don't know if I should express them here, but I do think there's a place for both. To be honest, I think
there is a place for both. Absolutely, yeah.
And I think that's another discussion we can have another day, because I could talk for hours on that. I think we're on the same page on this, Heidi. And just looking though at other aspects of medical related careers. So you've mentioned pharmacy. Becoming a pharmacist is also medically related. You don't have to just stand behind a counter every day. You can become a research pharmacist. You can go and work at a pharmaceutical company, developing new drugs, testing new drugs, that type thing. There's, in our school, we are the school, within our Faculty of Health and Life Sciences, we are the School of Allied Health. And within that, we have speech and language therapists, we have audiologists, we have the biomedical scientists, we have the physician's associates. I'm trying to think of all of the members of our school. We're quite a diverse school. Even out of our school, you get things like physiotherapy, you get occupational health, you get, there's so many. And this is why I say, you've said that, Eunice, you said that you want to deal with patients. Is there a specific area that you think you might want to help people with? Have you thought of physiotherapy? Have you thought of occupational health? Have you thought of becoming a nutritionist? Again, falls in with that kind of functional health thing, where you're actually, and I'm very pro this in myself, is the old adage of let food be your medicine.
Exactly. Yeah.
And in my experience in conventional medicine, we don't focus on that enough. I've heard too often conventional doctors saying diet won't affect that at all. And in the end, we end up finding out, like you said, people go to functional medicine, or they just try things out themselves. They find out that they've got an intolerance to something, for example. And once they cut that out, all of their problems clear up. No medication, nothing else. Diseases disappear just because of what they eat, which is quite interesting. That's why I'm saying I'm going on a tangent, and I could talk about it for hours. Eunice, is there an area that you think you might be interested in?
I've been looking into neuroscience. I don't know what it consists of, but the stuff I looked up, I'm like, I kind of like this.
Okay. Why?
I don't know. It fascinates me. My mother's a psychologist now, and the stuff she talks about, like the hormones and I don't know much. Like, I'm just speaking of what I hear, but the brain fascinates me.
So that's a great starting point. That's a great starting point. Find something that you're really interested in. Now, you've already said neuroscience, possibly. I was also going to suggest psychology is another direction to go, and you still need to understand human biology, because our thoughts are connected to our bodies. Our bodies influence how we feel. I mean, if somebody's depressed and they're depressed because they're feeling unwell all of the time, putting two and two together and saying, well, maybe it is your diet. Maybe you're on a medication that's not agreeing with you. Understanding human biology to help somebody psychologically is an important thing. But you ask about neuroscience. So again, doing something like a biomedical science degree or a bioscience degree, doesn't even have to be biomedical, would give you that understanding. And you could then go into understanding the cell biology of neurons, the pharmacology, like you said, maybe drugs that if they're taking antidepressants. How does that work? Like I said, I work as a scientific advisor with a cognitive health clinic. Do certain drugs affect the neurons? I mean, when we're trying to find a cure for Alzheimer's and dementia, that all goes on in the brain. But are those drugs working? What kind of side effects do they have? So that's definitely something you could create for yourself. You don't have to, and this is something I think students don't realize, is taking a degree doesn't mean that you have to become what that degree is called. All right, so a biomedical science degree, you don't have to become a biomedical scientist. It's just an entry into something else. If you did a biomedical science degree and then you did a master's in psychology, you start bringing those two together, and then you become a researcher in pharmacological, psychological compounds. I don't know, I'm making this up as I go along. But I want you to realize is you can pick and choose what you want to do. And don't think that the outcome has to be the end. So getting that degree doesn't have to define who you are. And this is a warning I usually give to medical students or students who want to do medicine. It's a big commitment. It's an extremely difficult course. Becoming a doctor is a lot of work. A lot of people drop out. A lot of people just, they can't take it.
Rate. Yeah, huge attrition rate, yeah. Exactly.
And it's because they've got this idea from watching Grey's Anatomy of what a doctor is. They don't see the reality behind it. It's definitely a calling. I think I have great admiration for medics, but it's not for everybody. And that's why I often have that question of, do you want to find a cure? You want to change the world being a doctor, but do you want to find the cure for HIV or cancer, or do you want to treat the patients? It's a big difference in so many ways, because if you want to become the research scientist, you do a degree, you do a PhD. You don't always have to do a master's. That's another thing people don't know. If you have really good grades in your undergraduate degree, in your honors degree, a lot of universities will let you go directly into a PhD. You don't always have to do a master's to go and do a PhD. You then do the PhD and you become a scientist. And even during your PhD, for example, my PhD, I'll take you back a few steps. When I became a biomedical scientist, I wanted to specialize in fertility. I wanted to help people have children. I was passionate about that. And part of my PhD was to do with reproduction. But by the end of my PhD, I'd done so much research, I'd found so many things out about reproduction that it changed my mind. I decided I didn't want to do fertility anymore. That had been my passion all through high school. I wanted to do something involved with reproduction. I went into biomedical science because I wasn't 100% sure. When I did my PhD, I knew I wanted it to be reproduction. I thought I wanted to do female reproduction. I ended up doing a PhD in male reproduction, but the two link up when it comes to fertility. But by the end of it, it had changed my perception. It had changed my idea. And we can discuss another time why. But I didn't end up following what I thought I wanted to do my entire life. So don't make yourself feel that you have to do what you think that you want to do, if that makes sense. Take it as a journey. Nothing in life is permanent. Okay, I'm sounding a bit philosophical now, but I don't think we tell young people this.
Journey. Yes, it's a journey. I mean, I'm on career number 7. I still don't know what I want to be when I grow up. I'm a trained engineer. You know, I used to build sandcastles. I did a master's, in geotechnical engineering. Haven't done that in 10 years. I mean, no, I did that for 10 years. Haven't done it. I retired 19 years ago. I'm a recovering engineer, what I call myself. But it's true. And, the one thing that I also wanted to touch on is that you mentioned physicians, paramedics. Is there a degree in because that's something else, Eunice, I don't know. And as you were talking about Grey's Anatomy, I was thinking, you know, the crossover Station 19, you know, that series that takes place in a firehouse, but, you know, they focus a lot on the paramedics.
Yeah.
And, you know, paramedics is also, it's kind of like you're an emergency physician's assistant. You are doing, you know, you have to be highly qualified. You are interacting with people all the time. You're doing like split-second decisions on saving somebody's life. You know, that's another area that I think there's a huge lack of good paramedics around, you know.
And it's good that you bring that up. I mean, we offer that degree as well. I'm not involved with it, so it's not at the forefront of my mind, but thank you for mentioning it. Yes. And especially if you're a person who's really, you get excited by things, you like an adrenaline rush, because that's what paramedics do. Exactly what Heidi's just said. It's life and death decisions very, very quickly. You need to be really well trained for that. And there are degrees in that as well. We end up finding that there's people that do paramedicine, they love it, but then they want to take it to the next level. So they then go and study to be a nurse, or they go and study to be a doctor. Let it be the journey. You don't have to, don't think that it's the be all and end all, that's the career path you have to take. Yes, there's time invested. Yes, there's money invested. Nothing is wasted though. Everything is a learning lesson. And I think we put too much pressure on young people to say, you have to make the decision now, and that has to be the course for the rest of your life. Okay, I've stepped in and out of academia, in and out of science. I've run my own businesses, totally unrelated to medical science. I had an events company. I used to run an events company. I used to do weddings.
Really?
I used to do corporate events. Okay, so, and then I came back to academia. It's just for a number of different reasons. I also, for a time, I couldn't work because of a location that I was based in. I couldn't work at a university. I couldn't run that business. So I started a business at home. I became a writer and an editor. I started off doing scientific writing and editing, and I ended up editing romance novels for people. Skills that I learned. Skills that I learned being a scientist, having an eagle eye, how to pick things up in documents that students have written, assignments that students have written, scientific publications that I've submitted and that I've reviewed. Those are all skills that I've learned that I could transfer to a totally different career. So from a scientist writing and editing to editing romance novels was one of the examples. I was quite successful at it. It's everything that you've learned is worthwhile. So please don't think that you have to make a decision and that decision is going to determine what you have to do for the rest of your life. And again, me being biased, if you're not 100% sure, go for a degree that gives you a couple of options. Go for and it doesn't even have to be a degree to start off with. Go do a diploma in something. Go do a certificate. If you're really not sure, don't feel that you have to make the decision straight away. I may be straying out of the remit of my purpose of being here today, but I just sometimes
it's all
think
useful.
It is. I think also don't feel pressured that you have to do a degree. There are a lot of careers that don't require a 4-year honors degree to be very successful, very happy, very rewarding, both personally, emotionally, financially. There's so much out there. I would just say do your homework before you make any decision.
One more question. It's not really related, but I've asked my mom. I like the Doctors Without Borders, where they like fly out. Is there an opportunity in biomedical science where you can go out to like Ethiopia, places like that, for example, and just help people, like doctors help the patients now? I don't know how to explain it, but I like the idea of flying around to different places and not working necessarily in one place all the time.
Of course. I mean, that's with any career. You find a charity and that's doing that kind of thing, and you say to them, can I either come volunteer or do you have a job for me? You know what I mean? And sometimes you'll see that they advertise for people like that. Sometimes they're paid, sometimes they're not. Interestingly, I knew South Africans who studied as biomedical scientists and they went to work in Dubai. Because the level of qualification that the South African biomedical scientists had at the time was so high. They were in demand around the world, and they earned fantastic money. I mean, for some people, it was a great opportunity. They couldn't find a job maybe in South Africa, went to Dubai, worked there really hard, got fantastic salaries. It was tax-free. They got accommodation paid for. once their contract was finished after 2 or 3 years, they came back to South Africa, bought a house, cash, bought a car, cash, found another job, and it's kind of set them up for their lives. So it depends what you want out of life. And the impression I'm getting from you is you want to help people. You don't just have to become a doctor to help people, okay? I think there's so many different things you could do to be helping people, and you don't need even a medical qualification to do that. You could, like I said, like your mom does the psychology, something's in that kind of field. You could do something psychology based. You could do, like I said earlier, speech and language therapy, going to these countries to help children that have been maybe in a mind blast and they need to learn how to speak again. A physical therapist or an occupational therapist, helping people walk again. Understanding how the body works. These are all things, all careers that you could do to help people. You don't just have to become a doctor to be able to help people. There are so many different options. Yeah, and we don't even have enough time today to discuss every single one. But I mean, I'm more than happy to come back and have a discussion with you and Heidi, and we can talk on maybe specific areas. Mm-hmm. But I would say do your homework, and this is part of it. Today is doing your homework. I hope that you found out a lot more today than things maybe you hadn't thought of before. So we've got a degree in health and well-being. So, and like I said, and then some universities offer double degrees. So you could do one in neuroscience, one in psychology, or one in neuroscience and one in nutrition, and you become a nutrition neuroscientist, therapist, whatever, you know what I mean? So look at your options, Eunice. You can create the kind of career that you want by choosing the degrees that you end up choosing. Yeah, I find it very exciting for you. You're at an exciting point in your life where it's stressful, it's difficult, but it's also really, really exciting.
Thank you. Thank you so much for this discussion. I'm sure there are a whole lot of other topics this can be an hours long conversations.
It can, and you know that I'm always more than willing to help where I can, Heidi.
Thank you very much. And Eunice, thank you for being here.